Hello.
Hey, who's doing Shavices?
Kath.
All right. Everybody, welcome to Within Summit. We are so grateful that you're here with us this morning, and we're so excited to have Shavice Turner with us. Today, we are going to be discussing the challenging weight stigma and discrimination on the journey to body liberation. Shavice, we're so excited to have you. With over 20 years of experience, Shavice Turner is an internationally recognized activist and advocate, speaker, policy influencer, and movement builder who dedicates her ability to make significant social change on issues concerning eating disorders, weight stigma and discrimination, and intersectional social justice. Shavice founded the Binge Eating Disorder Association in 2008 and successfully merged it with the National Eating Disorders Association in 2018, after 10 years that significantly changed the eating disorders community in both scope and focus. And currently, Shavice is the CEO of the Body Equity Alliance. Shavice, thank you so much for joining us today. We're so excited to have you.
Thank you so much for having me. I appreciate it. And good morning, everyone. I hope you've had your coffee. We are going to get started, and you are going to have a chance to see my messy, let's see here. Sorry, gotta figure this out. There we go. Okay.
Recording in progress.
All right, so as I said, we're going to get started, and this morning's talk is challenging weight stigma and discrimination on the journey to body liberation. And I see some folks here that I know, and they know how important and passionate I am about this issue and this journey to body liberation. And so I am thrilled that we've got some new folks as well who will be hearing this for the first time. So I want to just explain a little bit about my frame in terms of how I see the world and how that influences what I'm going to talk about today. First of all, I am a politicized activist who is seeking dignity for all. And I have a background in political science, and so that really informs everything I do. You know, the definition of politics is who gets what. And so I really see that as part of everyday life. Of course, my eating disorders journey, research, and the community at large informs my views as well. I believe humans can be trusted with food and their bodies. That's extremely important to me. I believe in the reclamation of the word fat, and I will use that throughout, but I will also use higher weight. I will not use the word obesity. I see that as a very stigmatizing word. I experienced weight stigma and discrimination and healthism, which we'll talk about throughout my lifetime and continue to do so. I believe these experiences created trauma that is ongoing. I believe any clinician treating fat clients must be informed about determinants of health. We'll talk about that today. I believe that the lived experience is essential to inform research and clinical interventions, I believe in a relational and intersectional way forward toward body liberation, and I hope that will become a little bit more clear as we go along this morning. And I want to see shifts in our field that include intersectional research, culturally competent treatment, and harm reduction. So these are some pictures of me when I was a little less, and I just want to give you a very brief overview of my story that sort of, backs up the way that I see the world. I grew up in a legacy of body shame, mostly from the women in my family, but also from the men, and it was really used as a tool. This is not my way of blaming. This is my way of not acknowledging that my family was a part of the culture, and the culture rejected, even back in the 60s and 70s, and I should say especially in the 60s and 70s with Twiggy and a thinness that was very valued. My mom would quite often say to me, I just don't want you to have the pain of being overweight. And she was doing her best. She had an eating disorder. And so, it was the time, it was what she had gone through, it was the culture. I was on a quest very early to fit in, and with my mother, explored various ways to lose weight as early as, 6, 7 years old. And as I went into my early teen years, I really became what I call the destructive rebel. I became very rebellious. Teenage years are a time to do that. But mine was especially destructive, with substance abuse, and a severe eating disorder, and all kinds of other behaviors that were really risky. Once I got through that period, I was at a really low point in my life and sort of flailing around, not sure what I wanted to do, and finally got into some therapy and back to college, and went through those years pretty successfully, got married, started having children, and knew that I still had work to do around the eating disorder. And so I started the Binge Eating Disorder Association. And through that, I discovered the health at every size and non-diet paradigm, and was fortunate enough to really learn under people like Wendy Oliver Pyatt and others who were very much at the forefront of this work, and we're just starting to be very vocal in our community. That was a total shift for me in terms of my life. It really changed everything. And it was the beginning of my quest to really want to seek dignity for other people like me who were living in fat bodies. And that's when I became what I call the constructive rebel. For those of you who know me, I don't have a problem really challenging things in the eating disorders community and standing up for marginalized communities and people who have not been heard and not been seen within the community. And that's not always met with open arms. And I know that, and it's difficult. But I think it's really important that people are able to do that and use their voices, not only for themselves, but for their community. And so a very different kind of activist emerged from myself in terms of what my goals were, and how I went about doing that. It was very different than when I was doing it in a very destructive way, when I really cared about issues, but I didn't have the capability of doing it in a more constructive manner. So the goal today is that we want to get to body liberation, and this lovely woman that I have a picture of is a podcaster and a registered dietitian. And I highly recommend the podcast. But body liberation, for those of you who are not sure exactly what it is, it's the freedom from social and political systems of oppression that designate certain bodies as more worthy, healthy, and desirable than others. That's what we want to get to, and that's what I'm hoping to give you some beginning information about today. So why is body liberation necessary? It's because of weight stigma. Weight stigma and weight discrimination are the reasons that we need to have this this conversation. And weight stigma and discrimination is examples of determinants of health, oppression, and healthism. And I'm going to go through what those things are rather quickly so that we can move on past the definitions. But the determinants of health are the social and economic environment, the physical environment, a person's individual characteristics and behaviors, and the context of people's lives really do determine their health. And so we know that blaming individuals for poor health or even crediting them for good health is inappropriate when we look at this in this frame of a determinant of health. We know that most people are unable to directly control these determinants. And there's a lot of reasons for that. There's income and social status, there's education, physical environment, social support networks, genetics, health services, and even gender. So I often talk about stigma and discrimination as oppressions when it comes to fat bodies, and it's very sometimes difficult for people to understand. But if you really understand the oppressions like racism, ageism, heterosexuality, and the oppression of the LGBTQ community, you can start to understand why this also is an oppression. And it's because weight stigma is not an isolated incident. It's the norm in healthcare and our society. And it's perpetuated by a very complex system that includes policies and behaviors and feelings. And again, it puts the placement of the blame for body size on the person, and then creates stigma and bias and discrimination around that. So that really fits into what we know about oppression. The layer on top of that is that we look at bodies and determine whether they're healthy or not based on their size. And we've come to this, pull yourself up by your bootstraps, and you are 100% in charge. You have personal responsibility for your health. And that in itself is healthism. We put the problem of health and disease at the level of the individual and make it a super value, rather than looking at all of those other determinants that we talked about to understand what is going on with any one individual and even at the community level. And for those of you who have not come to know the word intersectionality, this is another piece that's very important, because this is a concept or a lens in which we look at the places where people do not have power and where they are oppressed, where healthism comes into play, where social determinants of health come into play, and where all of those things interlock and intersect. So we know if you're talking about race, it's very difficult to talk about race for someone who is in a part of the LGBTQ community and fat without talking about those oppressions as well. So we're talking about those intersections really coming together, and we know from the research that adding in various oppressions increases the likelihood that people are going to have more negative social determinants of health. So that's really important here as we look at privilege. So I'm a white woman, I'm fat, but I have a lot of other privileges. And so my intersections are really just that I'm a woman and I'm fat. If I were a Black lesbian woman, you know, who was fat, that adds in two more oppressions and the likelihood that getting treatment, having access to care, having good food, there's all kinds of things that affects. And so that is very important as we're looking at weight stigma. This is a hot off the press study that was done by Bryn Austin at STRIKE, which is the Strategic Training Initiative for the Prevention of Eating Disorders. STRIKE is a public health incubator, and they worked with the Deloitte Access Economics to pull this study together. Dove's Self-Esteem Project was the funder for the study. And they looked at body dissatisfaction and appearance-based discrimination. And eating disorders and weight stigma are under both of those categories. What they found, and there's a lot more in this study, so I did include the link here, and hopefully these slides will be going out to everybody. But we are spending as a society here in the United States $305 billion annually due to body dissatisfaction. And we're spending $501 billion annually due to appearance-based discrimination. So, you know, this is definitely costing our society, and the costs that are being spent are on therapy, it's loss of wages, it's, you know, all of the things that we lose when we have these issues, when we're stigmatized and we have body dissatisfaction. This was an intersectional study, so it was also looking at race-based issues, which I think is extremely helpful because, again, once we look at those intersections, we know that things get worse. So specifically in terms of weight stigma, what we know is that weight stigma is extremely pervasive, and in children, we often call it teasing and bullying. I remember stepping on the scale at school in the gym and my weight being called out, and, you know, then being teased about it. It's something that is ongoing when a person is in a fat body. It's ongoing for life. And that we know that experiences of weight stigma do create PTSD. And I actually say that, you know, PTSD is really looking at the past and the experiences that someone has incurred that are showing up in the body and the brain. This is chronic PTSD because it's happening every day, day in and day out. And we know that these types of issues are then leading to eating disordered and disordered eating. Weight bias was cited as the fourth most common form of discrimination in the US. And interestingly enough, while all of the other areas of implicit bias have gone down in terms of racism, in terms of the LGBTQ community and so forth, those have all gone down while weight bias has continued to increase. And if we look over the last 20 years, I think it's pretty easy to understand why we've had this, you know, quote unquote war on obesity that is really, it really has impacted the way that people think about fat bodies. And so it's no wonder that we've seen an increase in the body dissatisfaction, eating disorders, disordered eating, and so forth. To the right is the sources of stigma, and this is a study that was done back in, I believe, 2014 by Rebecca Pohl at the Rudd Center, which is now at University of Connecticut. And it showed the sources of weight stigma. Family members are at the top, and I mean, that makes complete sense. They're the people that we're with on a daily basis. And just like we have internalized these feelings around fat bodies, so have our family members. So that makes complete sense. And it's not a slight on them. It's just that they're normal parts of this society. And then the red lines are healthcare community, doctors, nurses, dietitians and nutritionists, and mental health professionals. And I think that that is really, really important, as we are a community of these folks. And it is extremely important that we're aware of the messages and the microaggressions that we might be sending to our clients. So what does weight stigma predict? It predicts dieting behaviors, dietary restraint, bulimic behaviors, binge eating, extreme weight control behaviors, fasting, diet pills, vomiting, purging, food substitutes, skipping meals, and this is just part of that list. And so we can see clearly these are all eating disorder symptoms. And the outcomes in healthcare are pretty stark and sobering. Weight stigma definitely produces stress. And we know what that means for the body. Besides the eating and physical activity behaviors, which we're very aware of in the eating disorders community, there are physiological reactivity, which these are things obviously that physicians are going to be looking for, but they're not going to tie it back to weight stigma. I know some people that every time they go to the doctor, the sugar levels when they take their the people that are diabetic, excuse me, when they take their sugar levels after they leave the physician's office, they're always high. And that is because they have anticipated and incurred weight stigma during that visit. That's very, very common. And for that reason, healthcare is avoided by many people with eating disorders and also in higher weight bodies. So it's really important that we understand that weight stigma has a physical effect, and it has a psychological effect: depression, anxiety, low self-esteem, and we know all of those things are a part of eating disorders. So it is a vicious circle in some ways. What weight stigma does, we've heard about the medical aspects of this. It's really important to understand that this doesn't just stop. This isn't a one-off. This isn't the type of things that the ACEs in terms of trauma really cover. ACEs look at accidents, childhood neglect, and those types of things. And all of those are very relevant. But when you are experiencing weight stigma, that is more than likely a daily insult, whether it's coming from the media, it's coming from healthcare providers, it's coming from family and friends, it's coming from people on the street who yell things out their window at you. There are all types of ways that you are stigmatized around body size when you live in a fat body on a daily basis. So it's not just PTSD and ACEs, which often are co-occurring, but it's this ongoing chronic PTSD that has to be addressed. And that's why it's so critical for weight stigma to be part of any type of work being done in the clinician's office. Stigma is a stressor, and we know that that in just 1 year, PTSD symptoms can show up. It doesn't take long. Increase in sustained anxiety as target of ongoing discrimination, bullying, microaggressions, and lack of physical and mental care is an outcome. Again, we're seeing those daily media images and perpetuated stereotypes that are doing damage to self-esteem and sense of self. And higher weight individuals themselves are internalizing this and becoming the bully and perpetrator. And I'm never proud of sharing this, but there was a time in my life when, as a fat young woman, I, had a group of friends who were not fat. I was the token higher weight person, and I would make fun of and say some pretty nasty things to other fat people. Not proud of that, but it is something that happens quite often to people who themselves have been bullied and discriminated against because of their weight. The other thing that I quite often did as I was going through my life and gaining weight and losing weight over and over and over again is I would espouse to anyone who seemed to need, in my opinion, to lose weight. I would espouse the wonderful new diet that I was on, and I would tell them what I thought they needed to do to lose weight. So this is very common amongst people who themselves have been bullied and stigmatized. Trauma is really the outcome of oppression. This is a picture of Pablo Sandoval, and my two boys are very into baseball, or else I would never have known about this person. But Pablo was an amazing baseball player, and he was a big guy. He has been outspoken about that, and even did a nude photo shoot for the cover of GQ, and his stomach was hanging out, and it was a beautiful picture. But he got a lot of criticism for that, and yet he was an amazing athlete who did things with his body that most people cannot. So it is an example of somebody being stigmatized because of the way they look, not because of what his body could actually do. And that type of ongoing shaming for everybody really does undermine the feeling of safety, the feeling of safety in your own body, and that is traumatic. So imagine that when you're talking about healthcare providers and healthcare providers who are shaming people about their bodies, who are offering bariatric surgery and other medications and so forth when you come into the office just to have a checkup because you have a cold. So these are the things that go on, and they're extremely detrimental. The more occurring stigma and discrimination, the more the trauma is relevant, or not relevant, but it is more harmful. So Pablo obviously is a Black man. I'm sure he's experienced anti-racism. I don't know anything else about him, but the co-occurring stigma of racism and weight stigma, I'm sure has weighed heavily on him. The wheel of power here, I think, is a really great graphic. And so I'd love for everybody to really kind of take a look at it. You'll see in the middle is the word power. The closer you get to the middle, the more privilege you have. The further out you get, you'll see the word marginalized, and you'll see that those are the people that are obviously further away from power. And so they're more likely to be marginalized, not have, access to care. Those determinants of health are going to be even more important in considering their health and the outcomes. They're going to be oppressed, and they are more than likely to have intersecting oppressions. So that's, I know that there are people who sometimes will say, why in the world are we talking about this in eating disorders? This has absolutely, this is social justice. This has absolutely nothing to do with eating disorders and with treatment for my son or daughter. And, this is just ridiculous. Are we going to sit in a clinical, in a room and talk about privilege? No, that's not what this is about. It is about knowing a person's background and understanding what they may have lived through, even from the get-go, even before they can tell you much. It's that cultural competency, so that we know that we're not hurting someone, that we are not doing further harm, because that is real. It is happening in clinical rooms between therapists and individuals, because the therapist does not understand the marginalization, the determinants of health, the things that this person has been through that are outside of, interpersonal issues or other kinds of trauma. So it is really, really important that we talk about this stuff. It's, it's not CBT, it's not DBT, it's not these clinical, ways that we're trying to turn around the person's relationship with food and so forth. But it is very important in the big picture and how we are going to help that person. So we talked before about stress, and oppression is chronic stress. In other areas, there's been a lot of studies done on oppression and trauma, and we can see very clearly that does create cumulative trauma, and that it is intergenerational, creates PTSD and other psychiatric disorders. Treatments must be adopted for positionality and intersections. And so, kind of looking at the wheel of power and understanding where somebody is and where their intersections may be is critically important. And the trauma recovery is not just about the work that's done in the room with the client. It's about what providers are doing outside the room to understand and change the systems. So it's really getting to know how these systems work and how they work in our clients' lives, and what we can each do on an individual basis to make changes and to help our clients navigate those systems and the changes that we want to see. It is about building resiliency in the client, but it's also about helping them get to a place where they can do their own advocacy. And maybe, like me, advocacy and activism becomes a way out of the eating disorder and a way to then contribute back to the field. And for you as well as a clinician, it's important to do work outside of the work that you're doing in the room with the client. It's important to do the reading, to become involved in different aspects of the movement toward body liberation. So here we are back at the goal of body liberation and freedom from social and political systems of oppression that designate certain bodies as more worthy, healthy, and desirable. I hope that that makes a little bit more sense now. And for the remaining time, and I will have some time for questions at the end, but we want to look at how do we go forward. And that's tricky. It is tricky because we do know there is the physical side of eating disorders for some people with higher weight bodies, the metabolic issues that they are experiencing. But some of the things that we know for sure is that a weight normative approach, and a weight normative approach is really the way that we are approaching health right now. It's the way that most physicians practice, and that's that they emphasize weight and weight loss, and that is the only way to health and well-being. So again, back to that example I used of somebody going into a physician's office for a cold and then being told they need to have bariatric surgery. We know that the weight normative approach is not effective, and it's not effective especially for people with eating disorders, but it really is not effective for anybody. And you know what we know about that effectiveness is that there's a high rate of weight gain, so that makes it weight regain, sorry, that makes it ineffective. Cycling from weight loss interventions, so there's that whole cycle of losing weight, regaining the weight, and studies show that some people regain up to 20% of some people regain an additional 20% over what they lost, and so they're continually becoming heavier because of the weight loss and regain. And it fosters more stigma in healthcare and society. And that is the underlie of what we're talking about today. Weight stigma itself is linked to adverse health and well-being, and that's the bottom line. So what we want to propose, those of us in the fat liberation community, is that we put the emphasis on viewing health and well-being as multifaceted, and so we're considering those social determinants of health while directing efforts toward improving health access and reducing weight stigma. So I am very fortunate to have a physician who does practice mostly from a weight inclusive perspective, and at least with me, she knows that we are never going to talk about weight in the room, and that we're going to focus on any of the metabolic or other issues that I may have, and we will treat those in a way that works for me given all of the things in my life. That is not the norm for most people, but that's what we're working toward. And there are more and more physicians who are embracing this approach because they're seeing that a weight normative approach is definitely not working. So for those of you who don't know Gloria Lucas, who's founder of Nalgona Positivity Pride, Gloria is really a somebody has their, is not muted. Could everybody check their muting, please? Thank you. Gloria is the founder of Nalgona Positivity Pride, and she is a Latina who has really been at the forefront of talking about health justice and health equity, and talking about social determinants of health. Her organization really supports Black and Brown people with eating disorders, and I highly recommend checking out her various educational programs that she does virtually. And she has a really great little shop with t-shirts with sayings and so forth. But I love supporting her and her work. And she talks about the socialization and healing from oppression, in that we are socialized to be silent, to utilize stigma and shame, when we could be reclaiming who we are with unconditional acceptance and connection, and really speaking up. And I think that that is really important as we're considering how we look at all of this, because it is complicated, it is nuanced, but we really need to be trauma focused and healing centered. And we can't do that if bodies are not all equal in terms of how we're looking at them, that we're not looking at them as good or bad bodies, or as, you know, healthy and sick bodies, which is the reason I don't use the word obesity, because it assumes that a person in a higher weight body is sick and has disease state. And that's just not true. Some people do, some people don't, just like some thin people do and some people don't. So it really is about getting to a place where all bodies have equal value. And then we consider all of those social determinants of health. We consider what oppressions a person may have. We consider what their intersections may be. And then we look at their physical and mental well-being and any issues that may be coming to the surface. So this is definitely a little bit of fixing the airplane while flying. And I think that in our society as a whole, we're understanding that many of our systems, not just our food systems and not just our health systems, are functioning in a way that is actually not helpful to most people. And so, you know, there's a lot of discussion about how we fix all of this, and it's all intersectional, all of the systems that we need to fix. And it's definitely happening on the fly, because obviously we're humans living in a world where we can't just stop everything, we have to fix it. But we want to be part of the solution and not part of the problem. And until we can really incorporate all of this, we're going to continue to be part of the problem. So I really want each of you to consider the positionality that you hold, and then also your clients hold. So, you know, looking at your own privileges and what that means when you're in relationship with your client in the room. And, you know, going back to that that circle of power and marginalization, and understanding how that could actually impact the relationship, and how you can be in relationship with a person in the room who has some marginalizations and oppressions, and may be dealing with very different social determinants of health than you are. It's so critical that every single clinician become, at a minimum, trauma informed. I've been doing my own reading and you know, understanding chronic trauma and so forth. And I find it very difficult now to understand why, in the eating disorders community, we are not encouraging all clinicians to get training in trauma. And so I really encourage each and every one of you to become trauma informed at a minimum, and to seek out trauma training specifically, if you can. I think it's really, really important. The other piece is to read and listen to the lived experience of those who are in different positions than you are, whether that's Gloria or the host of other people from marginalized communities that are really beginning to come out and talk about their eating disorder, how it developed, how they've gotten help or not, and what they see as being helpful to going forward. That's what I did when I started BETA, because I didn't have any other answers. There weren't people out there that I could go to really understand, back in those days, how can I be fat and still have an eating disorder? Like that, it seemed so far-fetched to me, and I wasn't seeing anyone who was representing me or looked like me in terms of my body size. So I had to become a part of the community and forge my way forward. I want to give Wendy Oliver Pyatt so much credit, because she was on the board of BETA when prior to our merger, and Wendy was the person sitting in a board meeting in 2011 who said, I don't know how we can keep doing this work on binge eating disorder without also having a platform that was going to discuss weight stigma. And we had a broad conversation, and out of that came Weight Stigma Awareness Week. And from the get-go, it was very intersectional. We had people of all walks of life talking about their experiences with weight stigma and how their other oppressions intersected into that and worsened their eating disorders. So this is not new. This has all been around for some time, but I'm glad that we're really having the opportunity to elevate the conversation. It is really important to consider trauma as an ongoing or as an ongoing thing when people are in fat bodies. And so if you have a fat person sitting in front of you in your office, you have somebody who has been traumatized. I mean, yes, there's the whole spectrum of how people react to those kind of microaggression and overt comments and experiences and trauma, but you must consider that. And I think really anyone with an eating disorder, I've heard plenty of stories from my friends who have had anorexia and bulimia and OSFED and the whole spectrum of eating disorders, who have experienced it as well in smaller bodies. So this is everybody. It's there in the culture, and it's not changing anytime soon. And then back to what we originally said on this slide is working to fix the system and not changing the body. Bodies do change, and there are many, many reasons that bodies change, but we really want to be working on changing the system and then supporting people who are living in bodies that are being oppressed and ostracized, and maybe living with a lot of social determinants of health that are not helping them. So it's really important that we're looking at the system and not placing the blame, not not utilizing healthism to put that blame on the individual. So that concludes my talk today, but I definitely want to be available for the next 10 minutes to take any questions. So I am going to stop, or Kath, can I keep my information up while we do this?
Of course, yeah, definitely. And I don't know if you can see the chat, but it does look like there are a couple
There's
of
a couple,
questions.
okay.
Mhm.
I'm going there. Okay, let's see. Okay, from Caitlin, is there anything we can be doing differently in the eating disorders treatment setting for patients who live in larger bodies? Is it helpful or harmful to have separate group therapy sessions for these patients? We find that some patients in larger bodies get triggered by patients in thinner bodies in group treatment settings when a thinner patient expresses a fear of weight gain, for example. How can we navigate this to be inclusive and validating of everybody's experience while not causing more harm or unintentionally perpetuating stigma? That is such an excellent question, and I hear this all the time. So I will tell you what my own feeling is coming from the lived experience perspective. I greatly prefer that to be, or I have in the past when I did groups, to be in groups with other fat people only. And the reason is that because what you've experienced as a fat person is unique, and it's unique to people who have never experienced fat, living in fat bodies. And the camaraderie and the support and the just crying because you know that this person really sees you and gets you is so important. I'm a member of a fat liberation group now that meets twice a month, and I get that same thing from these other folks, you know, when all of us are in recovery from our eating disorders, but we still experience weight stigma, and it still puts us sometimes into spirals where we really want to go back to our eating disorder. We really want to lose weight. We really want to do these things because it just feels so much better being in a body that is not oppressed and not made fun of. So that is an experience that is, I think, really important to have for a fat person. That being said, I know in the residential community, it's because of census, it's very hard to do that sometimes, but I do think even if it's 2 people in a room, that it can be very helpful. I think that there have got to be some really strong boundaries in groups where there's a mix of body sizes and there are people that are fearful of becoming the size body that someone in that group is showing up as. You know, I'm not a clinician, so I'm not going to, I have my opinions about what should and should not be done, but I think that you know, would you allow someone in a group to sit and talk in a derogatory way about someone's race or, you know, someone's sexual orientation? This is the same thing, and I understand that we're talking about eating disorders and, you know, all of the things that happen interpersonally and but I think that we've got to do some protection of fat folks in eating disorder recovery, because I have definitely heard so many stories of people being traumatized in treatment because of groups specifically, and from clinicians who don't understand weight stigma and the microaggressions and that sort of thing. So I hope that gives you a little bit of insight, Caitlin? Okay, great. Would you recommend using therapeutic approaches to treating trauma like CPT for treating folks who have been impacted by weight stigma? I'm not sure that I feel comfortable recommending any therapeutic approaches, again, because I'm not a clinician. So I'm not sure that I'm just not sure I want to do that. But I hope that that's something that all of you can reach out to clinicians that you know and respect who are doing trauma. Obviously Wendy Oliver Pyatt understands this. Amy Pershing in Ann Arbor is really kind of one of the thought leaders in treating higher weight people and trauma. And she's excellent. Reaching out to her. This is something that I can recommend to Wendy, maybe doing another talk on with a clinician, but I'm sorry, I just don't want to, step outside of my own expertise as of someone with the lived experience.
Amazing. Thank you so much, Shavis. If anybody has any other questions, we do have a couple more minutes.
Kath, is everyone going to get the slides?
There will be a recorded version of the session available on your dashboard once
Okay.
the session has ended. Yep.
Okay, thanks.
Of course. All right. Well, thank you all
We have
so much
one
for.
more.
Oh, sorry. Just saw that from Lacey.
Yep. How do you recommend talking to kiddos about fat bodies to raise them to be body positive? That's a topic that's getting a lot of chatter lately. Obviously, it starts in the home, talking about these things on a very, age appropriate level. Really taking inventory of yourself to make sure that you're not utilizing any, microaggressions or, you want to normalize food, all the things that we know in terms of eating disorders that we want to do with kids, but then, promoting the fact that all bodies are equal and that they all deserve love, they all deserve dignity. There are we don't have much time, so I'll just say there's a great Facebook page that is parents who want to end the cycle of weight stigma in their families. And so, you might want to look up that. There's all kinds of really great ideas that parents are utilizing, and they look for support when they're not sure what to do. But I do think that it's, it really is getting it straight for yourself, and then modeling is the most important thing. Anything we can do to support family members who have dealt with this oppression. It's social media is terrible, and yet it's great. There are lots of fat people to follow who talk about this and who show themselves as fat. It's about normalizing, and it's about setting boundaries with people around the fat people. If you have the voice and can do it, standing up for those people, that's really very important. And there are more and more resources online about weight stigma and about the harm that you can share with family members. And if you want to reach out to me directly, I've included my information here. Anyone can feel free to reach out to me directly, and I can put you in touch with some resources. Recommendations for straight size people to educate. Yeah, it's like any other area. Straight size people, you want to give fat people the opportunity first, just like, when I consider if I'm going to do a talk or other jobs, I look at, like, do I have something to offer here that is good enough that I don't need somebody else to step in. I'm not going to do a talk that a Black person should be doing. But I think talking about, your chronic health issues is really important. Those are hidden disabilities often. And so that's very important. And you can be an ally, but giving a talk, you want to make sure that you're clear that, I'm an ally and I've learned from other fat people. You're welcome, Jennifer.
Great. I think unfortunately that's all the time that we have today, but Shavis, thank you so much for your time and for answering all these amazing questions. We're so grateful to have you here at Within Summit.
Thank you again.
Great. Everybody have a great rest of your morning.